busy schedule, busy days, nights.
Gail is not alone, especially this time of year. Stress levels are up. But a massage wasn't even enough to help her relax, so she decided to check into acupuncture with one little drawback.
A fear of needles.
This is the man who will insert those acupuncture needles. Omar Jute is an acupuncture practitioner.
So Omar, Gail's not alone. How do you soothe somebody who comes in here that has a great fear of needles?
Well, there are 2 or 3 specific points that we can use to induce stress reduction and relaxation, which is almost immediate. And so what the patient experiences are some profound changes in their neurochemistry within 2 or 3 seconds, and they start to relax.
So what's the first step when somebody comes in for acupuncture?
Well, what we're going to do first is we're going to assess traditionally the 3 pulse points on the radial artery, and it gives me an idea as to what's going on with her the energy of her kidneys, the energy of her liver, and the energy of her heart. The human body circulates electromagnetic force at the same frequency that the Earth does. And so when you look at these old pictures of magnets and the flux patterns around them, well, we have the same electromagnetic flux patterns. And acupuncture is the science of manipulating these flows of energy in the body to enhance not only energetic flow, but to balance the function of different organs.
And that's why I wonder, how does it work? Does it actually deaden a nerve or the tension, or does it affect your brain into thinking that you're not having the pain anymore?
Well, it does all those things.
And by taking those pulses, did you determine where you need to insert the needles, the pressure points?
Yes, and so what we're going to do is we're going to insert needles in different places that are going to cause her pulses to change. There are over 1,000 positions to insert needles in the body.
Now, is there any risk of nerve damage or anything when you do something like this?
We don't traditionally do direct stimulation of a nerve root with acupuncture. These needles are all sterile, and they're only used one time, and they're disposed of immediately.
They're so thin for a needle. They're almost hair-like. They're so thin you can hardly see the tips.
They're very much close to the thickness of a human hair, maybe twice the thickness of a human hair. We're putting these in because we're going to create a loop of energy that's going to cause her muscles in her neck, shoulders, and her back to relax.
We always think stress or back pain with the acupuncture, but you've been working with the hospital on some recovery for oncology patients?
Yes, we treat what's called chemotherapy side effects. Chemotherapy induces a great amount of heat, toxic heat in the body, and acupuncture can be used to disseminate and decrease the amount of heat, also reducing the nausea and improving the appetite.
And he credits this ancient Chinese treatment with keeping him from being sick even one day in the past 26 years. A half-hour acupuncture session can be used to treat everything from depression to gastric disorders to migraines.
You didn't really feel the needles, and it was just a tingling sensation, warmth, very, very relaxing after you had them all in, and so easy to fall asleep and very calming.